What are the symptoms of prostate cancer? How do I know if I have prostate cancer? Well, it's a good question because a lot of times there are absolutely no symptoms whatsoever. The prostate gland is part of the anatomy after urine is formed in the kidneys, it goes to the ureter, to the bladder, then it comes through the prostate gland. So anything that enlarges the prostate gland can cut down on urinary flow. That could be a symptom. It could be that you have some urgency. If the prostate cancer has gone too far, you may have some bone pain. But in general, I think we ought to look at prostate cancer as it may not cause any symptoms at all. So how are we going to know if we have the diagnosis? There is a blood test. It's called a PSA, prostate specific antigen. And there are certain levels. If it goes above those levels, we're suspicious. If we recheck 6 months later and that PSA is going upwards, then we're pretty suspicious and you have to carry on further for the diagnosis. The diagnosis usually involves getting a biopsy, and the biopsy then is looked under the microscope. If there's prostate cancer, we can grade that. There are tests we can do to find out if that prostate cancer has spread into the bones. And then the treatment comes on. The treatment is excellent. It can be, because prostate is a very slow growing cancer. A lot of times, probably the best treatment would be skillful watching, where you don't do anything but every 4 to 6 months maybe check that PSA or the digital rectal exam to see if that cancer appears to be growing. Sometimes that would make me nervous to be watching and knowing that prostate cancer was there. But after the age of 70, it frequently is a slow growing, and you have to look at what other medical problems you have and what your chances are of living 5 years. That's a discussion you have to have with your doctor. Then there's radiation. Radiation can be an external beam where you have the radiation that comes and is concentrated on the prostate gland, or you can actually insert seeds of radiation into the prostate gland itself. That's excellent treatment. Most people will choose surgery. And now there's different kinds of surgery. It used to be just we did regular surgery. Now we're doing robotic surgery. The robotic surgery is supposed to cut down on bleeding and cut down on problems that we have after surgery with maybe impotency or incontinence. So you have to talk over these things with your doctor. They're now doing, through a laparoscopic type approach, they can take out the prostate gland that way. Lots of new advances in surgery. So maybe no symptoms, get your PSA, make a good discussion with your doctor and make a decision for the best form of treatment for you. It could be just hormone treatment to suppress the growth of this prostate cancer.